All right. Well, thank you for joining us for another episode of Longevanity. My name's Amber Bocknek. If you haven't joined us before, I'm a physician with an aesthetic and longevity focused practice out in Ontario, Canada. And I'm very excited today. I have a guest with me. So before we really get going, I just want to make sure everybody again is aware we're going to have a really detailed and interesting conversation, but the purpose of the information we're sharing here is for education and advocacy. So anything you hear, I want you to be, using it as a tool to have your own conversation with your own healthcare provider. Please don't take any of our conversation as personal medical advice, but please do take it home and ask questions of the people who care for you, and make sure you're always doing all of these things under the guidance of your own care provider. So with that said, I want to introduce you to Dr. Harpreet Lote. She and I met, we were actually recently at a MERS global event. This was sort of like an invite only event for some of the long-term injectors with lots of experience, advanced techniques from across the globe. But I got to meet one of my neighbors from home. And by neighbors, I mean
Oh,
West Coast Canada. So
woohoo.
Harpreet and I were sitting together at the meeting at a table and just had a lot of stuff to talk about. So Harpreet, I'm just going to hand it over to you. People in my area haven't met you before. Can you just share a little bit about your practice and your location and just anything you want to share? Go for it.
Yeah, so it was an awesome meeting. We'll talk about that some more, but it was great to meet a fellow Canadian. And we did feel like neighbors, even though I'm in beautiful British Columbia in the Okanagan Valley in Kelowna and Kamloops, BC. That's where my practice is located. And yeah, I've been in the aesthetics field for 20 plus years now, about 25, and it has changed. Boy, has it changed over the years. My practice is primarily working with women in my age group. So premenopausal, menopausal women over 35 make up the majority of my practice. We do have younger patients as well, of course. And the focus has always been in our practice to restore structure for people and really work to bring people back to how they looked maybe 5, 6, 7 years ago. So that sort of natural aesthetic is what I've always been working with. And I've loved my journey in aesthetic medicine. It really marries my passion for technical things as well as art, because I love to paint and draw and all those visual art things. Just I love it. So it's been great. And along the way, I've got to meet people like yourself, which is amazing.
Yeah.
Yeah,
So
that,
yeah, it's super fun. And I think in this case, again, this is one of the many things that was kind of neat about the meeting, is meeting people again with similar interests and similar disciplines. I love how you describe our demographic, because yeah, you and I
yeah,
are both in the same one. I
yeah.
kind of laugh with my patients. It's like, I'm really kind of resistant to the fact that I have to accept that technically I'm a middle-aged woman. But it's so interesting again, and a lot of my patients are very similar to your demographic. I treat all my gal pals, my sisters from different lives, so again, many of us are in the same, and I think we're hearing the same thing here in Ontario as what you guys are in BC, is that the goal is to look like yourself, but
Absolutely.
a refreshed version of yourself. And I think it's interesting because we have a similar career trajectory over the time frame. We've seen a lot of different fads come and go. And it's one of the things I thought we could maybe talk about that would be of interest to both of our practices, is sort of the transition from filler of a decade ago to where we are now. Did you want to? We had some really interesting talks about this sort of regenerative
Yeah,
processes. Did you want to kind of lead off a little bit about that? I don't know if you want to talk about
sure.
how it comes up in your office, or if you want to talk about some of the differences, but yeah, take it in the direction you'd like.
For sure. So it comes up naturally in the course of discussion in our clinic, because I think it makes a lot of sense to approach people's aesthetic needs based on physiology. So both of us are physicians, and we have a scientific background, and we approach things in a sciencey way. So when somebody comes in talking about I look tired or I look saggy or I'm seeing these changes on my face, what I want to understand first is why that's happening. So looking at how does the human face age? So we know that we lose volume both in our skull and our fat pads, and that contributes to some of that look. So we get fat pad loss, skeletal volume loss, and then things in our skin also change. You know, the skin structure changes, the thickness, the pigmentation starts to get a bit uneven, and the skin wrinkles more easily. So when we're looking at tools to address those things, we want to address all those aspects. And in the past, we had fillers, which helped with volume loss. And then we do have things like lasers and other things to help with the skin quality, but we really haven't optimized our use of things that affect a bit of both. And the physiology of the skin, the regenerative capacity of the skin, I don't think we've optimally harnessed in the past. And that led to use of filler. You know what they say is like if you have a hammer as a tool, everything looks like a nail, right?
Yeah.
So I think that happened in aesthetic medicine, and so now we have these regenerative treatments. So for me, that conversation, it flows naturally. So I'll say, well, we can use filler. It's still a tool. It's still a useful tool, and we also want to address the decreasing regenerative function of your skin due to aging. So this happens naturally. It happens to all of us. But here are tools that we can use to just amp up that regeneration, that wound healing. That is often how it comes up. So we use it in combination.
Yeah. And I think conceptually, people are really open to that and are welcoming of that discussion. I have to see when I have somebody new here, and I'll have you let me know if this has been your experience too. Um, People don't want to look done. And when I ask them, well, what does that mean? What is it that you're seeing? If you're walking in the mall and you're like, oh, she had work done, what is that? And they're like, oh, the cheeks are huge and the
Yeah,
lips are huge, and it doesn't look like anything that happens in nature. I'm like, okay, I think I have a good understanding of what you're looking at, and what you're seeing is overfilling. And
yes,
so again, the old concept was, again, exactly like your analogy, if all you have is a hammer, everything is a nail. It was the old times previous technique of trying to use a filler to blow up the face so much that it was lifting and tightening, but it really wasn't lifting and tightening. It's like overfilling a balloon. It just got rounder and rounder. And then people didn't look like themselves anymore. They didn't even look like a naturally occurring human anymore, never mind
100%.
themselves, right?
Yeah,
So again, this is an image that's in people's heads and like, oh, well, if my significant other knew I was doing anything, they would be so unhappy. And I'd be, well, why are they unhappy? Like, what is it they're worried about? And usually it boils down to concern for health. Like they love their loved one exactly as they are and they don't
yeah,
want them taking risk. And two, they love their loved one exactly as they are and they don't want them to look like a different person. So
yeah.
again, this is where this regenerative process comes in. Did you want to talk a little bit again? So, like, I know my patients might not be so familiar with the term biostimulation. Did you want to speak a little bit to that, maybe, and just share a bit as if, again, you were talking to patients in your office, how you're combining things and what a biostimulator is? Did you want to chat about that a little
Sure,
too?
sure. So biostimulation is a term that you're going to hear all over now because it is so popular. But you're right. The question is, what does that mean exactly? Well, bio is biology, your physiology, and stimulating it. So we have natural repair processes in our skin. You know, if we cut ourselves, we will heal ourselves, and that reparative aspect of our skin is what we're trying to stimulate with biostimulators. So injectable biostimulators might target certain cells within your skin to make more collagen, which is part of the wound repair process. But there's so many different types of bioregeneration that we can do, and depending on what goal we're trying to get to, we might choose a different tool. So yeah, I would say it's just stimulating your biology to do something that we want it to do.
Yeah.
How do you explain it to your patients? I'd love to hear.
So I'm like an analogy girl. I love
Yeah,
analogies. People
I
make
love
fun
it.
of me here in the office because I'm always talking in terms of analogies. So my favorite is, and again, I would echo you. Again, being a little bit of an old school science nerd, I always like to sort of draw back to the anatomy, but I know that not everybody appreciates the
For sure.
science. So I try to keep it real. So my analogy for the science and the anatomy is a layer cake, because most
Yeah,
of
I
us
love.
have enjoyed a layer cake at some point. So I try to explain to people that aging of the face, similar to you, happens at multiple layers, but I describe it as a layer cake, and that the bottom layer is hard substances, the bone, the skull. And again, I'll ask people, I'm like, have you ever noticed like your aunties or your mom or your grandma, as she was getting older, she got shorter? Have you ever seen people do that?
Totally.
They're like, oh, yeah, yeah, that happens. I'm like, well, do you know why that happens? Has anybody ever talked to you about that? Or do you know that already? And they're like, well, no, not really. I notice it's a naturally occurring thing. I'm like, absolutely. And again, I'll go on to say, well, they get shorter because there's reabsorption of the bone in the spine. And when you have like little vertebral bodies stacked on each other and they're all getting smaller, then the overall height comes down. But I said it's not just limited to your spine. Unfortunately, it is happening with your face. So
Yeah.
when you stopped growing as a young woman, and again, for some girls, it's like as early as like 13 to 15, they've reached their peak height, they're at peak bone mass, and they maintain that to their early 30s. That's when your bony skull is the biggest. But then from again about 30 something onwards, it starts to reabsorb like your spine does. And so you don't get a shorter face, but you get less projection. So
Yeah.
like even the thickness over the brow, the prominence and the curvature flattens. And as it flattens, and I say to them at the end of the day, the icing on the layer cake doesn't shrink, but all these other layers we're going to talk about too. And as the prominence disappears, the brows flatten. And then I said, you know, your little eye sockets? I said, they are getting larger because the perimeter is reabsorbing. So your eyes are becoming more sunken. There's less holding it up. And again, they come down. And then your projection of your cheekbones is disappearing. It's reabsorbing, it's flattening. And so the skin that used to be projected here is falling. And then I said, have you ever noticed that the distance, and I said, you may not have, but you will now, between the bottom of your
Yeah.
nose and the upper lip in older people looks longer? Well, it's not that it's getting bigger, but the rounding out of the bone is flattening. And so it's dropping and that's coming down and the lip is rolling under. And then I said, lastly, then again, the jaw itself is shrinking. So this fundamental base layer is shrinking. And we really don't have a lot to fix that. And then I talk about the deep fat pads. I say layer two of the layer cake are these deep fat pads. They're very structural in a couple of really key points. The temples, some people start to look a bit like a peanut. They kind of
Yeah.
go in,
Totally.
right? Peanut. Another key target is sort of this mid cheek here again, loss of volume there. And then the ligament line underneath the eye starts to deepen and flatten. And then again, also too, in the outer face, they can get kind of skeleton-y looking if they're losing this out here. So I said, this is again, looking at some of our tools, that may be a place for some structural filler. Or if you're a surgeon, again, the fat grafting. Then the third layer of the layer cake is the ever so important connective tissue layer that integrates with some of the little expression muscles, as well as it holds those structures. But with the loss of the volume below, it's not in the same place. Every day we're alive, gravity is pulling it down, and that is all coming down. And that is what's giving support to the next layer of the layer cake, which is our little subcutaneous fat pad, which feeds and nourishes the skin. And then, of course, the skin at the top. And so
Hmm.
the problem is all these layers are getting affected. So it's just exactly, and I use that toolbox thing. And I think, again, one tool does not fix it all.
No.
Fillers, the other F word, may have a role in a little bit of revolumization, but we don't use fillers to fix everything. If we were a surgeon, we might consider grabbing that connective tissue layer and pulling it. As non-surgeons in our office, do you have anybody doing surgery in yours, or are you completely non-surgical where you
We
are
don't.
too?
Yeah, we don't. Completely
Yeah,
non-surgical, but we
non-surgical.
have interesting tools there too, right?
Yeah. What are you guys using for the connective tissue layer? Do you have some techniques in your office that you use for that layer?
Yeah, so we use microneedling with radiofrequency, which is Morpheus 8, and we can get down into that connective tissue layer and really sort of regenerate that and tighten that up, which is wonderful. That's been great. And then some of our clinics have Althera, which is ultrasound, and that's visually guided. So you can get down to that layer of the layer cake and tighten that up. So that in combination with all those other tools is really great. How about yourselves?
Yeah, so for us too, we're more like your sister clinics. So we've got the Althera. So we like to use that for that third layer of the layer cake. And then those biostimulators you were talking
Yeah,
about, we do that in that sort of second layer, like the second from the top, that
yeah.
subcutaneous, just right underneath the skin layer to kind of nourish it and feed it from above. So one of the big things I try to talk to my patients about is that once you start to get these progressive issues across different areas, you want everything in moderation, a little bit of all of these little things, but very targeted to the different levels of anatomy where
100%.
the problem is, can end up giving really nice natural looking things instead of taking filler and trying to make filler do everything. So
110%. Yeah. And same thing. So I love combining different modalities in moderation, as you spoke about. So you can use those biostimulator injectables in that second layer, and you can combine it with your Althera or your radiofrequency microneedling and really amp up your results. I think that's a beautiful way to do it. Yeah. And then even in those that the volumization aspect of it, some of these bioregenerative fillers will actually help replace some volume over time slowly in a way that's very gradual. So it's not a dramatic change all at once, which a lot of people are looking for. As you said, they're like, my partner doesn't want to see dramatic change right away. And I don't want people to know that I'm doing. And it's interesting, people in our age group, still there's that little stigma of doing things to yourself, which I find the younger generation is much more open about these things. Yeah.
yeah, I think because they've grown up with social media, it's like, and
Yes.
they've been using filters, right? So again, if
Yeah.
you're going to throw a filter on, like, what's the big deal about doing these other things? So
Yeah.
yeah, it's interesting.
Interesting.
So if I were like a patient coming into your office and I was, okay, my age, my demographic, right? Again, sort of quintessential midlife, and
Right.
having laxity and lower face issues, and you're sitting across, what sort of, again, if you were to try to explain, okay, these, you've already kind of walked through, this is happening, this is happening, this is happening. And now
Mhm.
you're at the point where you're saying, okay, if they're asking, well, if I wanted to do sort of a very gradual, like a very slowly progressive course of action that will help take the clock back a little, what order would you recommend, and how would you put that together? What would you suggest as a treatment plan for sort of the very
Yeah.
sort of quintessential, for lack of a nicer word, midlife woman?
Yeah. Yeah, it's so different for each patient. And it really comes down to, I think, what brought them into your office now and at this time, and what are they looking for in terms of their treatment trajectory. So you have some people that will come into your office and they've thought about this for a while. They've been looking in the mirror for a year or two, and now they're at the point where they just want something done, and they might want something that's quick and more visible and more impactful immediately. And then you might have the woman that's been thinking about this, doesn't need to see immediate change, but they want to start addressing this. And those are two very different treatment
Hmm.
trajectories, right? So
Yeah.
like for the first person, we may reach for a combination of filler and also biostimulator. And I would go back to your analogy of the layer cake and the peanut shape and all this. So I often will use the analogy of a balloon where you've sold or those shrinking apples. Do you remember you used to make those?
Yes, the Apple
I
dolls
don't know if kids
where
make those
everything,
anymore.
no,
I
there's
don't think
lots of
they do.
things they don't do that we used to do.
It's very instructive when it comes to
Yeah.
aging, right? So
Yes.
you're sort of shrinking, and that balloon is getting deflated, and you lose volume, that peanut shape in the temples, especially runners, they tend to lose that
Mhm.
first, I find. And then you'll have this sort of mid cheek loss, and you get this downward sort of progression of all the tissues with gravity. And that's what's causing this lower face. So it's a combination of multiple things. And, oftentimes people will come in and say, well, I just don't like this little line. Can you just fill it in? And we have to have a whole conversation around why that might not be the best option. Because you're putting filler into an area where the face naturally becomes more full as you get older, and that could make you look older, right? Could make you look more masculine. So we have those conversations. So for that first patient who wants more rapid change, we might use a filler slash biostimulator where we're actually using it almost like a filler, but we're getting some biostimulatory effect from it. And these products can be used in blended ways that give you those properties, but might actually start in the upper face to help restore some volume. It will help give you back a triangular shape to the face, because as we get older, if you start to look at people carefully, they get more square, and you lose that sort of triangular shape to the face. So we may start there and then keep working on skin quality, and use, the other interesting tool is Botox, which people are quite familiar with. But in the lower face, it can be very useful because our depressor muscles become stronger as we age too. So we have this muscle that wraps around like this and wants to pull everything down. Our chin gets shorter, and these muscles at the side of our mouth want to pull down as well. So there's so many multiple tools that we use, and the order in which we use them is going to depend on the person sitting in the chair, their psychology, their personal preferences around what they want to do. Yeah, and then budget too, right? So
Right.
that's sort of how I approach it.
Yeah. Yeah. I think we have a fairly similar approach that way. And
Yeah.
again, too, it just depends on also to their comfort level and their fear factor. So
Yes.
some people, if this is like the first ever visit and I call it dipping the toe in the water, and they want just something ultra conservative, very minimalistic. Sometimes again too, that's where using some of the muscle relaxants, the
Yes.
neuromodulators, again known as Botox, Xeomin, again along the jawline, just again it's not that these things lift. People talk about them lifting with me all the time. I'm sure you probably get the same. I explain to them it's not lifting. What it's doing is it's removing the additional antagonism of pulling down with
Exactly.
gravity. Gravity doesn't need any friends. So again, if we can take away some of that extra pull down, then again, it sometimes gives it just a little bit more, very subtle, nothing dramatic, increased contour and shape of the jaw, and better
Yeah.
overall shaping and smoothness of the lower face, which can sometimes be such an issue. So
Yeah.
yeah, it can be
Yeah.
challenging.
Yeah, and
Well,
I think it's a perfect tool, like, neuromodulators like Xeomin, Botox, Dysport, they're such great safe tools as well, and perfect for that person who wants to dip their toe in. It's interesting that, do you get people that come in and say, "I saw this person, they looked so odd, and I don't want any Botox because their lips look so weird," right?
exactly, all the time. And this
All
is
the
sort of go
time.
right back full circle to the start. It's okay, well, what is your concept? And then they describe these people at the mall or the grocery store with the enormous cheeks and the big, big
Yeah.
lips. And so part of it is that I think in social culture and in social media, they use the filler words and the Botox words interchangeably, and they're so different. So people they think what they're seeing as Botox, what they're actually seeing is overdone film. So
Yeah.
again, there's a re-education piece that needs to happen there, because again, I find, again, I would also agree with you, the most conservative, least risk first intervention is generally those medications, the Botox
Yes.
medications. Yeah,
Yes, very safe, very studied, and, yeah, I would recommend them to a friend, a relative. They're pretty safe.
very safe.
Yeah,
Exactly.
yeah,
All right, girly. Well, we're kind of coming out to the end of our time here, but I want to do a couple things while I've got you here. So,
sure.
for those of you out here in Ontario who haven't met Dr. Lote before, she's a wealth of information, and she also has a presence on social. So, if you enjoy your Instagram, I've got a little QR code there, and if you just scan that, that will bring you over into Dr. Lote's world as well. So you can follow my Canadian sister from another life. Dr. Lotte also regularly podcasts. So if you enjoy watching podcasts, I have a option, and I have an auditory option for you as well too that'll follow. So if you're a visual person, then you can see Dr. Lotte. Again, I have a little QR code just over there. Please feel free to give that a scan, and then again, you can stay connected that way. If you like to bring your podcasts on your walk with you and you prefer to listen, there are audio files available for Dr. Lotte in her clinic too. And again, this is our little link here for the audio version of that. And again, if you're out in the BC area and you're watching this, then please come see her in person. So you can learn more about her office and her website here. This is actually a nice little link for her website for the clinic. So, for those of you who are in Ontario, if you want to see us and learn more about some of the different things we've done here, this is the QR code that will bring you into our world. This is at thriveaurora.com, and you can learn about biostimulators and Botox medications and fillers and Ulthera and microneedling all there. And if you are a little bit more interested in some of the hormone health issues, I have some information for you there. If you're again in my vintage with perimenopause and menopause, I've got a new book that we put out, Hot Flash to Hot Damn. So if you want to be in that category, please feel free to scan. We have a free companion workbook. You don't have to buy the book if you just go into Amazon Preview. The QR code is just as you're scrolling through the first few pages. And you can just start with the workbook. And if that resonates with you, then the main tool is there for you as well. And lastly, before we sign off, if you are enjoying the content, we would love to have you subscribe. And please send me questions or topics that you would be interested in hearing because we'd love to talk about them. Finally, before we go, a final reminder, today's content, like always, is educational and it is not intended to be personal medical advice. So please, anything you've heard here, ask those questions. Bring it to your trusted care provider of choice. Make sure you get the care you need. And thank you so much for watching. We'll look forward to seeing you on our next episode. Bye for now. Bye,
Bye.
Harpreet.
Bye.
There we go.